Hello. I am incredibly grateful to be here in person to celebrate this huge milestone with my fellow graduates. To be honest, I haven't done this in a while, stood in front of a real live audience, that is. Over the past couple years, when I've given a presentation, it's been on Zoom or another digital platform, miles away from my audience where they couldn't see if I was wearing pajamas. Perhaps this feels a little surreal for you too, being on campus, seeing your professors in person for what might be the first time. It's been 2 years since we've been able to come together as a school to celebrate, and much has changed. At least for today, we still get to wear pajamas. To prepare for my address today, I did what any good public health researcher would do. I conducted a literature review. Yes, I collected preliminary data on who would be here, about 4,000 people, including graduates from the classes of 2022, 2021, and 2020, faculty and staff from the School of Public Health, and of course, friends and family. I also listened to speeches from scholars and comedians, actors and authors. Some of these speeches were funny, most were inspiring, and every single one spoke to what they know. What I know is the scientific research process, so this one won't be funny. And because I'm following the scientific research process, I now need to cite my sister who added that joke, and because she insisted. But now, let me make a hypothesis. The graduates here today, we will make the world a better place. That may sound lofty or ambitious, I understand, but I know this because we have already started to see results. Some of us are working in health systems to tackle barriers to care for tobacco, alcohol, and other substance use disorders, making care more acceptable, accessible, and affordable to patients. Other graduates here today are using implementation science approaches to scale up school-based programs treating tropical diseases in low and middle-income countries. And others are on the ground, partnering with and advocating for people experiencing homelessness, for farm workers and their rights, for mothers and their children, and for the Coast Salish people on whose lands we reside. We are developing community health worker-led interventions and validating measures for use in routine care. We are identifying structural solutions to public health problems and putting them into practice. This is a fraction of the work we have been doing through multiple global pandemics, and I don't see any evidence that we are going to stop. But as sure as I am that we will do important and impactful work, I know that this work is by no means a linear process. It is fraught with setbacks, rejections, never-ending track changes, exhaustion tears, and the occasional late-night beer. Much like conducting analyses in our studio, working toward a public health degree requires troubleshooting, running loops, and at times getting obsolete error messages that even Google can't decipher. So maybe the process isn't pretty, but one of the great things about public health is that it truly is a team-based discipline. You are not alone in doing this work. Continuing with the research theme of this speech, I'd now like to introduce a conceptual model. We are impacted by the systems and societal structures we live. This includes environmental determinants, systemic racism and discrimination, and policies that promote and impede our well-being. For some of us, this means acknowledging the power and privilege that has helped us complete this degree. For others, you've accomplished it despite uphill battles. Now, as public health experts, it is our job to decrease the slope of these uphill battles, to identify, evaluate, and put into practice structural solutions that promote equity at every level. Speaking of levels, within these structures are institutions and communities like the University of Washington, where we have learned to think critically, research rigorously, and practice with passion. We now join a vast network of UW alumni. Shout out to Joyce Tapley, our amazing keynote speaker, as well as the classes of 2022 and 2021 and 2020. They are forging paths for us to follow and build upon. And within these communities, we have found our people, mentors who have invested themselves in our personal and professional development, staff who make it safe for us to return to campus, and student coordinators who hold our hand through administrative hurdles, peers who share our script, laugh at our nerdy jokes, listen to us practice graduation speeches, and with whom we can relate in a way no one else can. And finally, family, our given and our chosen family. Many of you are here today. Even if you don't understand what we are doing, you are here for it, with nourishing food, endless hugs, long-distance phone calls, and unwavering love. In conclusion, while I am all about data, I don't think we need to conduct a prospective cohort, fellow graduates, to know we got this. As we celebrate our achievement today, let us remember how much we have overcome, how much we still have to learn, and applaud the 4,000 people here and many more at home who made it possible. Thank you and congratulations to all.